We are talking about the mammary gland. The mammary gland is a modified sweat gland. Okay, it lies in the superficial fascia, tail lies in the deep fascia. Extent is vertical from second rib to sixth rib. The nipple line lying at the level of the fifth rib. Horizontal is from the lateral border of sternum to mid-axillary line. Morphology of the breast is described under three headings: skin, parenchyma, stroma. Parenchyma has nipple and areola. The nipple has ducts and muscle. The muscle is of two types: circular muscle and longitudinal muscle. Circular muscle increases the length of the breast. Longitudinal muscle, when it contracts, makes the breast makes the nipple flat. Areola has skin which is dark and pigmented, and Montgomery tubercles, which are openings of the sebaceous glands, which are for prevention of cracking of nipple. They secrete oily secretion. Parenchyma has 15 to 20 secretory units, okay, which is made up of apocrine cells. And these units open in a sinus and then continues as duct opens in the nipple. Stroma is of two types. Fibrous stroma is ligament of Cooper, and fatty stroma is made up of fat. Regarding the blood supply, venous drainage and lymphatic drainage, you have to remember only three words: axillary, internal mammary and posterior intercostal. Blood supply will be axillary artery and its first three branches, not the other branches like anterior circumflex umbrellum. The first three branches, the lateral thoracic is the main, the superior thoracic, the acromiothoracic main. Then internal mammary artery, that is internal thoracic artery, and posterior intercostal artery, branch of thoracic aorta. Venous drainage, axillary vein, internal mammary vein, posterior intercostal vein. This communicates with the Watson's plexus or vertebral plexus, and that's how cancer spreads from the breast to vertebral column and then eventually to the brain. Lymph node, lymphatic drainage, 75% into axillary lymph nodes, 20% in internal mammary, 5% in posterior intercostal lymph nodes. Applied anatomy of the breast has to be written under five headings: congenital anomalies, athelia, polythelia, multiple nipples; amastia, polymastia, multiple breast; no breast is amastia. Investigation 2. Self-breast examination, very important for all the ladies to keep on checking for the swellings at intermediate periods and especially after in elderly ladies. And mammography. Medical, just add itis, mastitis, inflammation of the breast. Surgical, mastectomy. Okay, it can be total mastectomy, radical mastectomy, in which all lymph nodes, everything is removed. In that time, the damage can happen to the nerves. Cancer of the breast. Okay, cancer of the breast. This is very common in females who have not conceived, who didn't have children. Independent lady who has not married also. They somehow the data shows that they are more prone. A female who has breastfed the kids is less prone. Veins, posterior intercostal veins, the cancer spreads to the vertebral column and brain. Lymph node, lymphatic drainage, if these are the four quadrants, upper quadrant of two upper medial communicate with each other. That's how cancer of breast from one breast to other breast spreads. The lower and medial quadrant communicates with the infradiaphragmatic lymphatics. That's how the cancer spills to the ovary as Krukenberg's tumor. Thank you.